think there's a twofold look at burnout where we're looking at the infrastructure, also resilience of the person. And if you're not well, you can't teach wellness, you can't take care of your patients the way that you want to take care of them. And we see studies that support that in other healthcare professionals. So wellness within the practitioner is very essential. And what I have to say, it's very refreshing to see over the past 10 years that there are more education paths, there are more CE coursework that actually show how to do that within your clinical space, and you can actually bring that back to your own self and apply those lifestyle modifications to help improve your resilience against stress as it accrues. I have to say though, optometry is poised to have more of a voice within the nutrition and wellness space. We've been doing it for a long time. Much more than our colleagues. And I do think that there is an element of feeling even more impactful with patient care. And I actually find it a mitigation to burnout when you learn about nutrition and wellness. And working with the Ocular Wellness and Nutrition Society has been so impactful for my own well-being because I feel like I'm actually making a difference. So I think that's also another space that we need to kind of tap into, connect our doctors to groups, whether it's at the AOA, their state associations, having that support group, talking to like-minded optometrists, and being able to have a social network within your profession is very key. But the Ocular Wellness and Nutrition Society really stands out because it is threading evidence-based stress reduction, nutritional interventions for a healthy lifestyle, period. And that's good for the doctor, it's good for the patient. I actually have good experience with working in different models within optometry. So I have seen some things firsthand. And I have to say, as students, we want to make sure that they feel empowered. So if they don't feel right, that they know that there's a way out. If there is a situation that they do not enjoy in terms of their workspace, that they have the ability to change the way they practice, perhaps shift into a subspecialty. You know, it almost feels like when you graduate, like that's the end of your career and you have to go with whatever comes your way. I think basically really empowering our students to understand that it's not an end, it's just a start. And also, I think organizations like the AOA is recognizing this. And you know, when you actually feel like you're involved in some of the legislation, some of the behind the scenes of helping to keep optometry independent, I think that also helps with work-life balance and burnout feeling. Students need to embrace that too earlier in their career. But yes, and lastly is to actually recognize early signs of burnout. So it's not so much waiting until you feel that hopelessness and burnout. It's to recognize it earlier on. And I do see optometry schools kind of bringing up more awareness in terms of stress mitigation with their students. So it's growing, but I do see it change in terms of just awareness and giving students some sort of ability to recognize it earlier and having some mitigation outlets. And being able to just talk about it, I think it's actually huge. When you express a survey like this and it's embraced, where you know you're presenting it in various large academy type settings, I think that shows students, colleagues, that it's something that needs to be addressed, and maybe just having that openness about it is the first step to finding solutions, because it was not seen as something that, you know, you were allowed to even talk about. I don't think I would be talking about burnout 15 years ago in my career. So I think that's a huge move forward. And I'm lucky this study had such good, basically reception to what it showed. And again, going back to the original conversation, it's not shocking. It's not shocking, but we need data so that we can prove that there is something to be looked at here, so that we can start implementing ideas to help fix it.